Welcome back, class. We're going to talk just a few minutes about modifiers when it comes to medical coding. And typically, a modifier, you're going to see them either used with CPT codes or HCPC codes. And they're two character, could be letters or they could be numbers. Um, it's a two character combination appended to either the CPT code or the HCPC code, and it provides additional information about the medical procedure, service, or supply without changing the meaning of the code. And as an example, let's say you go in for a radiology service. And so there will be a radiology code, and that's going to be what we say the 70,000 series. So there's going to be a 70,000 series CPT code. If there's going to be a tech, let's say a radiology tech that takes the film, then that individual is going to bill with that 70,000 CPT code and a modifier that says T, T for Tom, C, technical component, TC. And they're going to bill with that TC and they're going to be paid X number of dollars for the technical component. After they've taken the film where you broke your leg, remember we used that example, where they take the film, so they're billing that 70,000 CPT code and the TC for the technical component. Then they're going to turn around and hand it off to the radiologist, and the radiologist is going to bill a 26. 26 signifies the professional component. And you will see that a lot in radiology. You see it a lot in laboratory, where you've got somebody that's, to draw the blood. And when they draw the blood, that's just called a phlebotomist, comes in, draws your blood, or you go to them and they draw your blood. And so the technical component is, drawing of the blood, spinning it through the systems that they use in the laboratory. And then if it needs to go to a pathologist, so that's a TC. And if it needs to go to the pathologist, there's going to be a 26 modifier on it. So that's the way that you will see this information, whether it's on a claim that you've got, or if you're doing analytical work, you will start seeing that type of information. And as an analyst, it is extremely important when it comes to, and if they go back to the radiology, if it's a 70,000 code with no modifier setting out there, then that means the individual that took, and it's typically in a hospital setting, that they have a global rate for the technical component and the professional component rolled together. So when you're looking at 70,000 codes or 80,000 codes, that modifier is going to be blank. So there's a global fee involved, or there's going to be a TC in there, and that means that you're going to pay the technical component, or there's a 26 in there, and it's going to be the professional component. So as the definition says, it doesn't change the meaning of the base CPT or HCPC code. It just tells you how to calculate the reimbursement. Because if it's a global rate, let's say it's a global rate of $100, that'd be the global rate if it's blank. If it's a technical component, maybe the technical component's 40% of that, and to pay $40, and maybe the professional 60% of that, and to pay $60. And so that's important, and that's why you have these modifiers associated with HCPC and CPT code. Because also it adds specificity to a particular encounter. The service did not occur exactly as described by the code. And again, might not have been just a routine radiology. Maybe there are, if it's a surgical procedure, maybe there's modifiers for assistant surgeon. So maybe the surgeon was difficult. Maybe the surgery was difficult enough that you needed the primary surgeon and you need assistant surgeon. And both of those professionals are going to be paid. Trust me, they're both going to get their line share. So there's going to be but they don't get paid the same rate. So there's going to be a modifier for that assistant surgeon. Additional details such as the anatomic location. It can be program specific, both, and I said both the technical and professional components. More than one provider performs the service. Again, assistant surgeon. More than one location involved. And you see this a lot with either surgical procedures or radiology procedures where left and right arm, left and right lung. So that's where they're talking about more than one location. Or let's say you go into a dermatologist and they're taking off maybe some growths that, may be cancerous, and maybe they think they're cancerous. And there may be one on your neck and one on your back, or maybe one on your foot or something. So that's going to give information about specificity about the location. And it's, procedures go up and down in comparison to the typical requirements. So payments, when I say procedures up and down, I'm thinking more in terms of payments. So payments can either go up or down depending on what the modifier is. And again, it goes back, procedures may be bilateral. The procedure may impact both sides of your body. Service or procedures provided more than once. You usually see that in dermatologists or physical therapists. You may go in to see your physical therapist. You may go and see your orthopod who's doing some physical therapy work with you, and there's different modalities they can bill. I think chiropractors can bill multiple modalities too. So that's where it's talking about procedures, could be provided more than once. The AMA copyrights, they have the copyrights to CPT codes and modifiers. And they're, again, general, 2 digits. And some of the ones that I've already named, but in addition to that, there's the modifier 25. It's same day, but separately identifiable. So you could have 2 things happen on the same day. 26 is a professional component. 59 is a distinct procedural service. So you'll see 59 come through because with a lot of hospital or a lot of provider contracts, additional payments are allocated based on these modifiers. Remember, CMS maintains the HCPCS codes and the respective modifiers for them, but the AMA copyrights and maintains the CPT codes and their modifiers. Modifiers can be based on type. And it's usually, you've got pricing modifiers, causes price changes for the codes, whether it's a CMS 1500 or it's coming in on the UB04, it can change, change the price. Again, go back to radiology, and they're taking that film of your leg. If it's a blank modifier, it's one price. If it's an identical component, it's one price. And if it's a 26 modifier, it's another price. So those modifiers play a huge role in the reimbursement of those goods and services that individuals require when they go to see their provider. Also can be informational modifiers. And an informational modifier is not necessarily a pricing modifier, but are more statistical modifiers after the pricing modifiers on the claim. So there'll be some modifiers that CMS may want to use to determine how to change the reimbursement policies for Medicare and Medicaid going forward. Policy and individuals working on policy and healthcare populations with government agencies. These informational modifiers could be extremely valuable to them. And you've got some also modifiers that what they call the National Correct Coding Initiative, and you'll see it abbreviated NCCI. And they have some modifiers because sometimes you need those modifiers to override edits that you see in a claims adjudication system. So at this point, just remember that modifiers, for the most part, are going to be able to ensure that the proper reimbursement is applied to the claim. You can have modifiers for your CPT codes, which we talked about the HCPC level 1. You can have modifiers for the HCPC code, which again were the HCPC level 2 codes. And that's where you're going to see the modifiers, because again, it does have a significant impact on how some of the healthcare goods and services that consumers present for. And again, it doesn't matter. You can see these modifiers on the CMS 1500 or the UB04, either one, and it's going to provide information not only for the provider's office on how much they're going to be paid, or their hospital how much they're going to be paid, but it also provides information for the payer as to how to adjudicate those claims and to ensure that proper payment is made for those goods and services that have been consumed. And with that, we're going to stop, and we're going to come back. We're going to talk about revenue codes. Thank you.